Doctors, you got to look up. That's the thing. Wherever we're going, we want to look up. Don't just look down. One of the things when I took rollerblading, I took a class, and the first thing they teach you is don't look down at your feet, look up, because you're skating on the boardwalk. You don't want to be looking down here when things are going. Same thing in life when you're going, especially your profession, and as far as things are happening so dynamically right now, with Congress just passing a thing today where it's going to change healthcare in America dramatically. You got to see the opportunities. Pediatrics is one of the areas for dentists because there's a huge shortage of pediatric dentists in the whole country. And if you can get Pedo4GP, there's not but so many spaces to get into these residency programs. A lot of times there's waiting lists, but we have something that is new in the country, and it's something, well, it's new as far as the fellowship. I've trained dentists over the years, Pedo4GP, we do seminars and so forth, but now we have a fellowship program. It's a 1-year certificate program. This is something that's amazing because there's the opportunity. And what you want to do is be prepared. When you preparation and opportunity coming together, where's the opportunity? When there's a cutback. And the cutback that's coming is more on adult dentistry. And even if you don't do Medicaid, there's so many people that are on Medicaid that when those dentists are out of work, it's going to crowd your space regardless of where you are. And if you can do pediatric dentistry and there's a huge demand, you can go any place and get employment and your compensation goes up. This is something that you want to be able to do. Now, in 1 year, we have, and I started out, I'm a GP, and I was doing Pedo4GP back when I started my previous company, Kids Dental Care. So that was in 95. Damn, that goes back a long way. That was 30 years ago. But now I have young pediatric specialists. He's board certified, been practicing about 12 years. Dr. Brent Tucker, he heads up our program. And then we have another pediatric dentist that's helping out with the training. We have other seasoned GPs that's doing pedo, but we have 5 locations in Central California, beautiful locations. And if you get out there and do this 1 year, you are all prepared. Now, someone was asking, well, what's the benefits? One, the benefit is that now you are trained and you could go wherever. Or if you wanted to, and if you didn't get into a pedo program, we were just, one of the dental schools just contacted us recently because they have someone, they were overflowed. They couldn't put them in the program, but they can come and spend a year with us and then have that recommendation, because now you have the experience. And once you have the experience and the training, you get to shadow a board certified pediatric dentist and go through all of the training. You're ready. You're ready either to continue going as a GP or to step off into the residency program. And you're also ready to make more money. And just being prepared. That's why I say look up. Look up, because something is coming. There's change. And anytime there's change, it's opportunity. Take advantage of the opportunity now while you can. Just go to Pedo4GP/fellowship. Pedo, the number 4GP/fellowship, and sign up. We have these beautiful locations. You come out, you spend 12 months, and when you leave, you are prepared and your comfort level just goes up. You know at that point that you could go anywhere. And you know, when I moved from New Orleans to California, I came up with that term. At that time I had GP for pedo. So I had it flipped around, and I had that card and I sent it to different places, and I was getting calls just like that. Everybody wanted me because they were like, you do pedo? Come, I got a job for you. So it's the easy way to get the job, but you got to have some training. You cannot just go in and say you're going to do pedo. And most people are afraid. Most dentists that haven't had that experience, you're afraid, and I understand why. But let us help you get past that, because now we're going to train you. You get the experience. You get to shadow these doctors that have all of this experience, ask all the questions, do these cases, get the experience. Clinically, here's what you can expect. Number one, behavioral management. This is the thing that causes so much fear. Most dentists are afraid when the kids look up and they start crying, and the doctor almost start crying. And then if the parent get a little nervous, then everybody's in panic. You got to get to that point where you know how to do behavioral management. And we have, and Dr. Andrea Goodman, she's really expert. So she's doing the seminar on this, and along, with Dr. Tucker, who's, like I said, a certified expert. But we have some top people that'll help you with that behavioral management, so that you have that down, so that you learn to work with kids and you learn to work with the parents. It's a dual thing. You're working with the kids, but you're also having to calm the parents. And then diagnosis, so crucial. A lot of times you can't diagnose this way, and another doctor is diagnosing that way, and another one it's either this or it's wrong. There's only so many things that it could be diagnosed as, and you have to go through that. And that's why every month we have training on diagnosing and going through cases, case selection. That's big, case selection. Wow, which ones are you going to do? Which one do you refer? But don't change it to make it fit what you can do. You diagnose it first. You have to know what the diagnosis is. If you can treat it, then fine. If you can't, then pass it on to the next doctor who can, or refer it. We don't have to refer out, because we can refer it in-house, because we have the specialists that can do it. So then there's the restorative. There's a lot of different things as far as restorative materials and different cases and so forth. So you're going to learn a lot about that. Interceptive orthodontics. We have an orthodontist that's working with you to help you get to the point where you're learning a lot about these interceptive cases. Preventive treatment, which is big. That's the thing we want to do. We want to prevent a lot of it if we can. Of course, you want to make money, but you want to prevent these things from happening so that you're helping the community. And that's how we grow, because the community see that we're helping. And then the experience. That is where the rubber hits the road. You have to get the experience, and we have a lot of patients. So we put you in a busy office, but not by yourself, So you want to be shadowing at first, and you want to get cases that are kind of within your comfort zone. But then you want to push yourself a little bit outside, but you want to have doctors with the experience and the expertise that are there when you kind of step over, and then you're like, oh, doc, so you get that. We have that kind of training. And third but not least is this: you get to give back to the community and get the love. I'm telling you, working with kids, when the kids appreciate you and the parents appreciate you, after a while, the whole community loves you. And it reminds me of the Nat King Cole. This is, to give love and be loved is the greatest thing, something like that. You know the song. If you haven't, you should listen for it. Nat King Cole, to give love and be loved. And that's how it is when you're treating kids, because you're giving love. You're treating them, and the parents are loving it, because a lot of times they've been several places and couldn't get treatment. They went over here, they couldn't treat them. Went over there and couldn't treat them. And now you're like, no problem, I got this. And they're like, oh my gosh, and then they want to bake you a pie or something. And it's just love. And then the community, the mayors, everybody start to know who you are, and you just get that love from the community. Pediatric dentistry, whether you're a GP or a specialist, it's a beautiful thing. Join us. Take the fellowship. Get a certificate. And when you get that certificate and the confidence that goes with it, you can go anywhere in the world and show them, I'm certified by Pedo4GP. Here's my certificate. And they'll say, I got a job for you. Grow yourself. Prepare yourself, because change is coming. And I'm telling you, it's a good thing. Look up, see what's ahead of you, take advantage of it. Pedo4GP /Fellowship.